The anatomy laboratory and anatomical model and resource room are adjacent to each other. The students have large group lectures and clinical discussions in the lecture room using cutting-edge computer hardware and software. In the laboratory, students study clinical anatomy by dissecting their cadavers. This allows them to observe the variations among different human bodies, the effects of aging, and the results of diseases and surgeries. The facility has a variety of anatomical models and skeletons for students to use in learning clinical anatomy. The large group lecture rooms and small group rooms have computer hardware to access clinical cases along with anatomical and radiological imaging. The anatomy laboratory is equipped for digital image projection and digital video. This allows the professors to demonstrate interesting anatomy or pathology to the class by projecting the image on a large screen so that students can remain at their respective tables. The students can view streaming video demonstrations of a dissection of an area prior to doing the dissection on their own human cadavers. Several teaching assistants, medical students from the previous first-year class, assist the professors in doing pro-section demonstrations and laboratory work. A variety of clinical faculty from surgery, geriatrics, obstetrics and gynecology, and general medicine attend and contribute to lectures, small group sessions, and laboratory sessions. The course also has a weekly clinical case that allows the students to apply their anatomical knowledge to understanding a clinical problem. The students do this exercise in small groups with a faculty facilitator. Hands-on student use of ultrasonography is utilized in lectures and laboratories using state-of-the-art equipment. This helps the student better understand the relationships of the anatomy they are learning to ultrasound imaging of the human body. The use of human cadavers in the anatomy laboratory is made possible by the generosity of people who have made the ultimate gift to medical education by donating their bodies to the Florida Board of Anatomy.
The anatomy course at FSU College of Medicine is really something special because it's taken out ahead of all your other classes, 10 weeks over the summer. You really get a good framework of clinical anatomy that you build on later on for all of the rest of your medical education. And you also, at the same time, integrate imaging and embryology. So while you're learning the structures, you can say, okay, how does this develop? What does it look like on an X-ray? What would it be if something's wrong? And in the lab, you have lots of TAs from the first years that come in before you. There's volunteer faculty that are just there to help you out. And really just only having anatomy to worry about is really something special. And it just makes the transition into medical school a lot easier.